Hi, thank you for watching Yoga with Elia. This is Elia, and today I would like to talk a little bit more on the topic of lower back pain. And most of you have probably heard of lower back pain. It is a topic of much discussion these days for very good reason. Lower back pain is an escalating injury and pathology all across the world. The World Health Organization estimates that about 70% of all people all over the world are sure to experience lower back pain at some point in their lives. And this is actually the leading cause of disability worldwide. It has all sorts of costs, economic costs not being the least of them. And the worst thing about it is that it really is easy to avoid if we just know how to avoid it. So first I want to be able to just discuss on why lower back pain is occurring. And if we find out why, then we have a little bit more of a clear path ahead of us into how to go about managing it. Now, if you have lower back pain, you can manage it with these techniques. And if you don't have lower back pain, practicing these techniques will actually offset the chances of it ever occurring to you. So let's first get into the why. Now, to answer why is low back pain occurring so much in our day and age as compared to our ancestors, and by ancestors, I mean anybody from 50 years ago to 1,000 years ago, why it is that we're experiencing so much more as compared to those people, we have to understand what's so different about our world that wasn't different about their world and their lifestyle. Now, the biggest difference is not in our anatomy, it's not in the way that we look, it's not in the way that we think, but it really just comes down to technology. It is really the whole envelope of technology that we are immersed in, such as our cars, planes, trains, automobiles, computers, handheld devices, and all these other conveniences that we've all become very accustomed to. Now, these conveniences, of course, have their rightful place, and I celebrate technology personally. Technology and its advancements have allowed leaps in medical technology, leaps in just human scope of knowledge, but it has come with some costs. And so, with all of the human beings that came before our time that didn't have this technology, they had to do a lot of things manually. So, manual labor was really just the typical lifestyle for anybody. And it didn't matter how much of a genius you were or how productive you were, you still had to move your body. The average person had to know something about farming, they had to know something about tailoring clothing, even carpentry, in order just to get through the day. So a lot of time was actually consumed in things that we don't have to consume ourselves with anymore. We don't have to plow the field for 5 hours a day just to make sure we have food in the fridge. Now we can ensure that we have food, clothing, and shelter and never even leave the computer desk. Now, this is very fascinating, but it's without precedent. This has never happened before. And so when the modern human being, we see, has become so, the word is sedentary, as compared to all the previous human beings, what that really means is if we're not using our body, we're not constantly contracting and releasing our muscles, ensuring their integrity and function, we're not encouraging better circulation of our blood and better cardiovascular health, and we're definitely not encouraging better communication relationship of to our muscles, which is a neurological function. When all of that starts to get scaled down, when we sacrifice the degree to which we need to stay connected to our body through movement, what happens is the body gets stiff. So the old adage, if you don't use it, you lose it, is very true. And so as we become more sitting or seat based, we've also become more stiff. Now, the stiffness that I'm going to talk about that really pertains more to lower back comes in two forms. Just to show you, turn to the side and show you, it really is stiffness in two directions, and it's really along the frontal plane, the sagittal plane. But the two directions of stiffness that I'm mentioning here is going to be stiffness and flexion, forward bending, and stiffness and extension, or back bending. Now, let's talk about forward bending stiffness first. And in order to see how it is that stiffness in a forward bend could start to impose undue stress on the lower back, you just have to look at the anatomy and the connecting points of the hamstrings. What 2 points the hamstrings connect on the skeleton. Okay, so I want to demonstrate how those connections of the hamstrings actually impact the lower back with this spinal model. And I'm also going to use just a physical therapy band, a TheraBand. Now, the TheraBand is basically going to be your hamstrings, and your spine is your spine. And before we get into the movement part of it, as I've discussed before, what we're really talking about is the low back pain. That's the lumbar spine. That's really the lowest section of your spine where there's 5 discs, 5 vertebrae, and typically a healthy spine that has integrity and function in a neutral state, meaning when we're not moving, when we're just standing still, should have some lordosis in it, which means a little bit of extension or back bend. Now that is when the spine has the most safety and the most integrity, when that lordosis curve is in place. Now if you take your hamstrings are connected right over here to your sitting bones. And I'm just going to hold the bottom of the band with my foot because that's going to basically represent where your hamstrings attach to the leg. Now, what happens in a forward bend is you want to be able to bend not just the spine forward while keeping the pelvis still, but you want to actually encourage that your lower back maintains that curve, that lordosis, as you bend forward. So that means you have to go through flexion at the hips. Now, when you go through flexion at the hips, this is your pelvis here. Your pelvis is going to tilt forward as you bend forward. But as you bend forward, because of where your hamstrings originate, right here at the sitting bones lift further away from where they connect down at the leg. And as they lift further away, the hamstrings become more and more taut, and therefore it requires flexibility in order to achieve this much range of motion. But if the hamstrings are tight, what's going to happen is as you tilt, as you bend forward from the hips, the first little bit, so say first 30 degrees, your hamstrings are going to reach their final tight phase. So their final tight state, past which they cannot extend anymore. And so when they reach this state, but you still want to persist and continue to bend forward, then you're just going to start bending the trunk forward. And as you can see right here in the lower back, you're going to start to take away that natural lordosis of your lower back as you flex the lower back. And if your hamstrings were a little bit more released, a little bit longer, less tight, less restricted, you'll be able to tilt your pelvis and flex at the hips a little bit further, thereby allowing the spine to come down further without having to go through all that rough flexion. Now, I don't want to make too much of this because your spine, because you have discs, your spine is actually designed to move in a lot of different directions. So what I'm not saying is that it is bad for the spine to flex forward and to lose that curve, that lordotic curve in the lower back. The reason that it's problematic is just simply because of how frequently it happens. And it happens frequently because we still live in a body and we still have to live in a physical world, So if your hamstrings are restricted unnaturally, then every time you bend down to tie your shoes or pick something up off the floor or even just sit down in the chair, your hamstrings are going to reach their limit of flexibility, and it's going to force that flexion into your lower back a lot sooner and a lot more intensely than what looser hamstrings or more flexible hamstrings, I like the word more flexible, would allow. And so it's because you have to constantly do that every day. You have to bend down to pick something up off the floor, or you just have to round forward. We don't really live a lifestyle where you bend backwards in order to achieve anything functional in life. And so all of the forward bending with tight hamstrings then places much more stress on the lower back than the lower back is meant to handle. And what this actually means for us is if we start to mobilize, lengthen, extend the hamstrings, then every time we do bend down and every time we do sit down, we're not going to run into that problem. But I want you to actually try this on yourself and see at what point your lower back starts to round. So first, you can just do this from a sitting or standing position. You're just going to place your hands right here on your waist, on your hips. Technically, it's not your hips, it's your pelvis. So you're going to place your hands on your pelvis and just do this. Stick your butt out, right? You don't have to exaggerate, but you can if you want. You really don't have to. So once you know this movement, which is basically anterior pelvic tilt, that's when you stick your butt out, which also flexes the hips. So remember that. And you have the opposite, which is a posterior tilt when you pull your butt in. Now I'm going to turn around and you can do this with me. I'm going to lift my shirt up so you can see my lower back. You're going to take 2 or 3 fingers, use your fingertips because they're the most sensitive, and you're going to place the fingers right on your lower back. And basically your lower back is right above the top shelf of your glutes, which is exactly in the same place as the top edge of your pelvis on the back. So if you find your lower back, then notice if your lower back, if you can see here, has a little concave in it, like a little indentation, or if it's slightly pushing out. So if you do what I just showed you, which is if you stick your butt out a little bit, you will notice with your fingers that you create a little bit of a concave here. Okay, now that concave is that lordotic curve that your spine is the most healthy and stable in. So how you can test when your hamstrings have reached the limit for you is you're going to keep your hand right there on your lower back, your fingers on your lower back, and all you're basically going to do is either from a sitting or a standing position. For these purposes, you don't have to keep your legs straight, although this is the way that I normally teach lengthening the hamstrings. You're just going to bend forward and try to bend forward not by rounding the spine initially, but by sticking your butt out as we just tried. So you're going to try to keep your chest up and you're going to progressively start to stick your butt out as you come down. And you're going to try to stick your butt out more as you come down further and really, really try to stick your butt out as much as possible the further you come down. But eventually you will reach a point where that lordosis is impossible to keep in your back. So that's when you've reached, most likely, the limitation of your hamstring flexibility. And just as a side note, the human hip is technically unable to flex past about 120 degrees, right? So this is 90 degrees, 120 is about here. So technically it's impossible from the structures of your hip to flex your leg in that much further or any further without doing something else to the leg. But that's beside the point. So what you notice there is at some point you couldn't hold on to the lordosis of your lower back. And that's when your spine starts to flex and come out of that lordotic, safe, and stable position. So if the hamstrings were more flexible, unless you've already reached the 120 degree angle, you'd be able to go down further, therefore not impose all that pressure onto your lower back as soon. So I'm going to show you 2 very useful techniques that don't need to take you longer than 5 to 10 minutes of a day, or at least 5 days a week, that you can start to create better flexibility in your hamstrings, where your daily life will be supported in such a way that you need not experience lower back pain and you can actually begin to reverse some of those effects. All right, now all you will need is a yoga strap if you don't have a regular yoga strap, a belt, or any other durable material will definitely work. Just make sure it's not a TheraBand because you need some of that durability and some of that firm structure to actually be able to hold your leg up. You're not going to use the belt initially. It's optional. If you're going to use a yoga mat, just obviously make sure that you're comfortable, but you can just as well Okay, now for this exercise, we're going to be doing it just laying down. And all you will need is a yoga strap. If you don't have a regular yoga strap, it's not a problem. You can use just say like a regular belt from your clothing. If you don't have a belt from your clothing, you could just use a rope, maybe like a telephone cord. Just make sure that it's something sturdy. You don't have to use a yoga mat, by the way. You can just lay down on something soft. If it's a hard floor, definitely a yoga mat is advised. And if you want something to put underneath your head to give your head a little cushion or a little bit of lift, of course, that's going to be very optional. So we're going to do this laying down. And as I lay on my back, you're going to start first just by bending your knees, hugging your legs into the chest. And it's important to know the distinction between hugging your legs to your chest and keeping the thighs together or letting the thighs stay separate. For this exercise, we're going to keep the thighs separate because if you keep the thighs separate, you'll actually get a little bit deeper impact of that flexibility into your hamstrings, and you will still respect the structure of your hips because as you go deeper into hip flexion, you have to take your thighs out to the sides, which is laterally, in order to make sure that you stay right on track with the actual anatomical structure of your hip. So you're going to hug your legs into the chest. You're going to take a big inhale, and as you exhale, I want you to pull your thighs not so much into the ribs, but almost by the sides of the ribs, as if you're pressing the front of your thighs right down to the floor next to you. So you're going to do that on the exhale. And then as you hug your legs deep on the exhale, the next inhale, try to keep your legs hugged in that deep. So take a big breath in. Exhale, see if you can hug a little bit more. And as you're hugging your legs in, see if you can simultaneously start to press your tailbone, your butt to the floor, which is going to create that same tilt in the pelvis, flexion at the hips, and help restore that lumbar lordosis. So you take a couple more breaths. Every exhale, hug your legs a little bit deeper. And every inhale, keep your legs that tightly hugged in. Good. And then you're going to release your feet. Extend your left leg to the floor, and we're going to start with what's called a nerve glide or a neural mobilization. Picking up your right leg, you're going to interlace your fingers nice and tightly right behind your thigh. And you're going to let your lower leg relax. So don't even worry about keeping your shin parallel to the ground. Like actually let your shin and your foot kind of flop downwards. Make sure your left leg is steady. And you can adjust your hands to be either closer to the knee or closer to the hip so that your elbows have the least amount of bend in them, because you don't want to constantly be exerting in your bicep as you do this, in your biceps, because if you do that, then you'll have a little bit less of that cognitive bandwidth allocated to using your legs and hips. So you keep your elbows as straight as they can be, keep your hands interlaced tight. Now the thigh has to be vertical the whole time. It should not deviate from having the knee be directly above the hip. Okay, so you're going to inhale in this position. At this point, press your other leg down to the floor with the heel. And as you exhale, slowly begin to straighten your right leg. And then inhale, you're going to bend the knee. Exhale, straighten the knee. Now this is basically it. You're going to do this back and forth. Some of you won't be able to get your leg quite straight, maintaining a 90-degree position of your thigh. So if you reach the limit of your flexibility even here, that's fine. Just respect the limitations of your flexibility. And then you inhale, you're going to bring your leg all the way down again. Exhale, you're going to try to straighten it to that point, but see if you can push forward just another little increment. So you're always looking for how flexible that edge is of your flexibility. And we want to do this about 10 times in total on the right and the left leg. And keep in mind that when you're working on flexibility, when you're working specifically on stretching, we all know this familiar intensity of stretching. And we're going to use the 10 scale for this, 1 to 10 scale. Now, if the scale of 1 is I don't feel any stretch whatsoever, everything feels great and easy, and a level 10 is something that would force you to seek medical attention, then make sure that you never push past about a level 6 or 7 in that stretch intensity. So if that 6 or 7 level is reached when your leg stops about here, then respect that. And then notice if every time you do another repetition of this and you re-straighten your leg a little bit further, if you can go just a little straighter without breaking that 6 or 7 line of intensity. And over time, you'll be able to develop this flexibility fairly quickly. It's all about really just consistency. Inhale, bend the knee. Exhale as you straighten the knee more and more. Make sure that every time you straighten the knee, you do actually try to reach for the very, very end of your exhale. Last one. So I know that was a little bit more than 10, but 10, no less, per side. And we're going to go to the left leg, and same thing. Make sure that your hands are interlaced nice and strong. Keep your thigh vertical. Take a deep breath in first, and then as you exhale, slowly begin to extend your knee up. And at the very end, if you can get your knee straight, really try to kick out through the heel and pull the toes back. Inhale, knee bends. Fill up a lot. Exhale, knee straightens. Empty all the way. Inhale, bend. Exhale, straighten. So we're going to do about 7 more of these, and I want to briefly explain what it is that we're actually doing here. So this is basically a dynamic stretch, and what it's called technically is a neural mobilization. And the more slang terminology for it is it's a nerve glide or a nerve floss. And this is just a basic subset of neurodynamics. What neurodynamics are is a protocol where through movement you can start to unrestrict the way that your nerves, because nerves control all your muscles, the way that your nerves slide within and through the matrix of your muscle. And so in a healthy muscle tissue, the nerve should be able to slide right through the tissue as floss would slide through your teeth. Now what happens is either through overuse, misuse, underuse, or injury, some of our muscle tissue can start to get stuck onto that part of the nerve that's close to it, proximal to it. And this oftentimes happens, say, if you get some kind of an injury and you have scar tissue now in your muscle. The way that scar tissue is laid down is it's a very disorganized kind of lattice of muscle fibers. And it takes movement re-education to get that lattice, those crisscross patterns of muscle tissue, to straighten out and be laid down the way in the direction that the muscle is meant to move, the direction of the muscle fiber orientation. So if you don't clear that up, what happens is your muscles will actually hook on, or they'll just be stuck to the nerves, so that every time you try to move that muscle, or every time especially you try to stretch that muscle, you will end up also pulling on the nerve. And the nerves, they're not meant to be pulled on. If you pull on nerves, you're going to start to get nerve pain. And so what this allows you to do is, by virtue of movement, is re-educate your muscles, which will, a part of which means ungluing from the nerve tissue of wherever the injury or wherever the scar tissue, wherever the adhesion is. And this is always something that you want to do before the next exercise, which now we're finished, and this is where you're going to use your belt. So this is just going to be a simple hamstring stretch, a straight leg raise, but there's a little more nuance to it, which a lot of us tend to miss when it's just taught really quickly in class, or when we have like a 5-breath hold and a forward bend. There's a lot that needs to be explained, a lot that needs to be actually understood about our muscles, about our action in the muscles, so that good things happen. So you're going to take your belt, and you can either open it up to a big loop, or you can just open it up to a tail. Just make sure that you can get your knee all the way straight and make sure that you have the belt right at the heel. That's very important. So if I turn this towards the camera, it has to be at the heel, not in the sole of the foot, not at the ball of the foot. It has to always be right in the heel. And the reason for that is if you place the belt right over the heel, it's going to allow you to kick into the belt because you're going to pull down with your hands, and then you're going to be able to kick against where the pressure of the belt is exerting, and that kicking out of your heel will help you turn on your quadricep muscle and the entire anterior chain of your leg. But if you can't get your leg up straight like this, then just have your leg as far down, as close to the floor as you can, as you need to, in order to keep the knee straight. So if this is as high as your leg comes up, past which your knee can't stay straight as you go higher, then that is your edge, and that's where you're going to stay. So wherever that edge is, you respect it. Remember, it's that 6 to 7 level of intensity. So I kick out through my heel, I pull my toes back, I press the other leg into the floor, and I just continue to breathe. The important thing when you start to stretch, when you are considering stretching any muscle group, we have to come at it from a more active perspective. In the way that your nervous system is integrated into your muscular system is that in order for one group of muscles or one muscle to lengthen, the opposite muscle group, the antagonist muscle group, has to contract. And this is just what naturally happens when you bend your elbow and flex your bicep. It's because your bicep is flexing and bending your elbow, your tricep is actually lengthening and releasing. And the converse is true. When you extend your elbow, you engage your tricep, your bicep has to relax. That relaxation of the opposing muscles, that isn't something that we can control voluntarily. That is controlled through a nerve reflex. So we capitalize on that nerve reflex by even better engaging the quadriceps. So if we want the hamstring to lengthen, we have to consider what are the opposing muscles to the hamstrings. Right there on the opposite side of the limb, your quadriceps. So the amount that you can engage your quadriceps will relate the amount to which you get to lengthen your hamstrings. So a part of this movement, when you lay here, even close your eyes, you have to pay explicit attention to the quality of your quadricep engagement. That you're not just simply straightening your leg with the least bit of trouble and effort necessary just to get the leg straight, but you want to think about what is the most excellent way to straighten the leg, what is the most excellent way that I can encourage all 4 of my quadriceps to activate so that more of my hamstring tissue and fibers can release. And so the way that you want to structure this is you do this 1 minute per leg, just twice, and that's it. So you're going to switch sides, same thing, you're going to place the belt on the heel, make sure that this leg, because we're all slightly asymmetrical, that you really take each limb on its own. You interpret it on its own terms, that you don't just try to fit the flexibility of the previous leg on top of this leg, but if this leg is more flexible, take it to its degree, its limit of flexibility at that 6 or 7 level, and don't just try to match what you did on the other side. So I'm kicking out through the heel, I'm pulling my toes back, and again I press down with my right leg, I engage my left quadriceps really like mad. Relax the jaw, relax the tongue, in about a minute. And I would even suggest that you just use your smartphone, you take a timer out, and you can just time it. If you're pressed for time, you can be in and out in 5 minutes. Part of engaging the quadriceps more functionally, more holistically, more completely, we need to take into account that it's a part of the whole anterior side of the leg. So muscles that are located on the anterior side of the leg are considered anterior chain muscles. Now, these anterior chain muscles will better engage if the entire leg cooperates in that movement. So to get more output out of your quad, you want to be able to engage your lower leg at the front of the shin, the muscles at the front of the shin, by pulling your toes and the forefoot back towards you, which is why I said kick out through the heel. Because if I do this with my foot and I plantar flex my foot, I'm going to kind of confuse the information in the legs a little bit, where I'm going to engage my calf muscles, because the calf muscles is what does that movement, and the engagement of the calf muscles doesn't really support the engagement of the front of the leg. They support the engagement of the back of the leg because they're on the back of the leg. So when you pull your toes back and kick out through the heel, you make this stretch more complete. So that way, it's not just simply a hamstring stretch only, it's the entire back of the leg stretch, which is a lot better, again, because it's complete and it's unified. And really, this is the way that our body is meant to move, in complete, more functional patterns that replicate everyday movements of our life. And so you do that for 1 minute, twice each leg. Start with the nerve glide and then end it with this. You're in and out 5 minutes, 10 minutes tops. Make sure you keep an eye on your breath, and that'll be the end of it. Okay, well, thank you for watching, and I hope you enjoyed that. What I want to just leave you with is the spirit of consistency. It's consistency in this practice, it's consistency with this technique that is really going to ensure the most results. And this is something that I talk to every client about. I've taught this in teacher trainings. The most important thing, the most important action that's going to ensure that you actually see changes, good, important, healthy changes in your body, is your consistency, what is called client or patient compliance. It's what you do outside of a formal session or a formal practice that is really going to make the biggest difference. If you go into a class or a session once or twice a week, it's difficult for that time investment to offset all the other time that you spend in your day not doing the session or the technique, which is also even compounded by the fact of all the years that you spent, again, not doing the technique or the sessions. And so you have to give yourself time and consistency in order to see these results come about. So that's why I say a daily practice really is necessary. If you can't make every day happen, then no less than 5 days a week. And since the time investment is really only 5 to 10 minutes, if you're hard pressed for time, I think you would be even more hard pressed to find a reason for why you don't deserve 5 to 10 minutes a day for your own self-care, just so you can ensure that as you age, you are not going to experience and incur injuries that are going to start to really delimit your quality of life. Now, this is just part 1 video of how to create better hamstring flexibility. Check out part 2 on how we address the front of the body and the famous, maybe infamous, hip flexors. Thank you for watching.